Continuing with chapter number 5, Therapeutic Approaches, today we will be studying the psychodynamic therapy. This is on page number 94. The psychodynamic therapy was pioneered by Sigmund Freud, and his successors are called Neo-Freudians or Post-Freudians. So these Neo-Freudians or Post-Freudians are a group of psychologists who had initially worked with Sigmund Freud. They had the same perceptions about personality and about psychological disorders, but there came a point in time where they broke away from his school of thought and they developed their own versions of the psychodynamic therapy. Now, the psychodynamic therapy, all of us know, emphasizes a lot on the unconscious part of the mind or on the intrapsychic conflicts, and they feel that it is the intrapsychic conflicts or the conflicts within the minds of people that causes psychological disorder. So within the psychodynamic therapy, we'll be dealing with a few things. We will look at the methods of treatment they use. We will look at the steps in the treatment process. We will also look at the nature of therapeutic relationship. And towards the end, we will talk about the final outcome of psychodynamic therapy. So first we have the methods of eliciting the nature of intrapsychic conflict or the method of treatment. So since the psychodynamic therapy believes that it is intrapsychic conflicts that causes psychological disorders. So if a client or a patient suffering from a psychological disorder goes to a therapist who practices the psychodynamic therapy, the first aim of the therapist would be to find out what are those intrapsychic conflicts in the client. Okay, so and to find out those intrapsychic conflicts, there are two methods that psychologists use. One is free association and the second one is known as dream analysis. Free association is a technique where the client is made to lie down on a couch, keep his or her eyes closed and let the thoughts flow and talk freely about whatever comes to his mind without blocking out anything. So that is why it is called free association, where they are not supposed to screen out anything that comes to their mind. They have to freely talk about everything that crosses their mind. And it is also known as a couch therapy because the client is made to lie down on a couch. The second technique is dream analysis, where the dreams of the clients are analyzed or interpreted. It is also called dream interpretation. So sometimes the clients are asked to recite or narrate their dreams. They are also asked to maintain a record or a diary where they keep writing all their dreams right on waking up, because we have a tendency to forget our dreams, right? So, and all those dreams are interpreted by the therapist to find out the elements in the unconscious, because it is believed that all the contents of the unconscious are sometimes let out through dreams. Next, we have the modality of treatment or the process of treatment. So in psychodynamic therapy, when the therapist continuously applies free association and dream analysis on the client, there will come a point where the client will identify the therapist with the authority figures from the past, usually from the childhood. And that point in time is known as transference. So, for example, if I am a client who suffered from, say, major childhood abuse, okay, childhood sexual abuse, and now when I'm going to my therapist and the therapist applies free association and dream analysis on me over various sessions and does it very regularly, there will come a point where I will start identifying the therapist to the person who had abused me in the past. Okay, I will start feeling that therapist is the person who had done all those things to me in the past. That point in time is known as transference. And transference is a good thing, is a good sign in the psychodynamic therapy. Because when that happens, now see, if I start identifying the therapist to the person who abused me during my childhood, I will start expressing all those emotions and feelings that I had suppressed all these years, right? So that way the therapist will kind of come to know the thoughts, feelings and emotions that I had buried inside me. That is why when transference takes place, it is a very good sign in psychodynamic therapy, and the therapist will keep encouraging that to happen again and again. See, transference is when the client starts identifying the therapist with the authority figures of the past, usually childhood. For example, it could be a punitive father, a father who has been very critical of the child, or it could be the negligent mother, the mother who did not love and care for the children. So that is transference. Now again, there will be a point called transference neurosis. Transference neurosis is a point where transference is full blown, okay? So the therapist becomes like a substitute of someone from the past in the present. So this is the point where the client will completely believe that the therapist is the person from the past, okay? And transference can happen in two ways: positive transference and negative transference. Positive transference is if the client idolizes or falls in love with the therapist and seeks approval of the therapist. Okay, so this is very rare though. And the negative transference is where the client has feelings of hostility, anger, and resentment towards the therapist. So, in the example that I had given you, if I am a client who had undergone childhood sexual abuse, I will have negative transference towards my therapist. And I will look at the therapist as the person who had abused me in the past, and I will be hostile, I will be aggressive towards that therapist. Why? Because I will believe that that therapist is that person from the past. So this is about transference. So when transference will go on, again there will come a point where the client is going to feel very distressed and is going to find it very painful to deal with all these emotions and all these painful memories from the past. So the client will try to resist or stop transference. That is known as resistance. See, since the process of transference exposes the unconscious wishes and conflicts, thereby increasing the distress levels, the client resists transference. So the process where the client tries to resist transference is known as resistance. Resistance is of two types: conscious resistance and unconscious resistance. So if you are a therapist, you will know that your client is consciously trying to resist if your client deliberately hides information. Okay, so you're asking something and your client refuses to talk about it. Then you know that very intentionally or very consciously your client is trying to resist the process of transference. Unconscious transference is the one where the client becomes silent during therapy and recalls very trivial details that are not important for the therapeutic session, or misses sessions. And sometimes they come up with things like they are busy somewhere else and they will not be able to take that appointment. So that is when the client is unconsciously trying to resist transference. Next part of the process of treatment is interpretation. Interpretation is looked at as the pinnacle or the peak or the climax of psychoanalysis. So interpretation happens because of two processes. One is confrontation, the other one is clarification. Confrontation is where the therapist points out to the client an aspect of his or her psyche that must be faced by the client. So, a client with a psychological disorder will have various issues that he or she finds it difficult to face, that he or she finds it difficult to confront. Okay, so as a therapist, you will have to help your client to confront or face all those issues. That is what is meant by confrontation. Clarification is where the therapist brings a vague or confusing event into sharp focus. Meaning, when we have very painful and very unpleasant experiences and situations, we kind of tend to forget about all of those things after a point of time, especially if those things happened during childhood. Now, as a therapist, it is your duty to clarify all those vague and confusing memories and events of the client uh, to the client. So you have to clarify all of that. You have to make it very clear for the client. You have to point out, so this is what had happened to you, and you need to accept it. So that is the process of confrontation and clarification. Now, when confrontation and clarification is done again and again, so the rapid use of these two techniques leads to working through. Working through is where you know that the therapy is going successfully, or it is going to help you or heal your client. Now, working through, or the continuous or the rapid use of confrontation and clarification, will lead to insight. Insight is the final outcome of psychodynamic therapy. So, if your client obtains insight, then you will know that you have been successful in treating your client. Insight is a gradual process where unconscious memories are integrated into the conscious awareness. So it does not happen all of a sudden, okay? Insight is a very gradual process where you will bring all the unconscious memories of your client. You will help your client to bring back all those unconscious and painful memories of your client and integrate it to the conscious awareness. You make your client accept or face all those painful situations from the past. Now, insight is of two types: intellectual insight and emotional insight. Intellectual insight is where your client gains an intellectual understanding of what happened to him or her, to basically just understand what happened during his childhood or what was the traumatic situation that he was trying to avoid. That is intellectual insight. Emotional insight is being able to understand all the emotions involved in the traumatic situation and being able to accept all those memories or all those events emotionally. That is emotional insight. So once your client has gained insight, you know that your therapy has been successful and your client has been healed. Now, moving on to the last part of the psychodynamic therapy, where we will be studying about the duration of treatment. Duration meaning the time period of treatment. So like I had mentioned earlier, psychodynamic therapy is one of the most lengthiest psychotherapies. It can last for several years with 1 hour session for 4 to 5 days per week. So the psychodynamic therapy is very lengthy because they use techniques like free association and dream analysis, and because they try to find out things about the unconscious, and it is not a very easy process, and hence it is very lengthy. The duration of treatment in psychodynamic therapy can be divided into 3 stages or phases of psychoanalysis: initial phase, middle phase, and termination phase. Initial phase is the one, or the first stage is the one where the client builds the therapeutic relationship with the therapist, gets used to the timetable and starts recognizing about at what time to come, when are the appointments, on which days of the week does he have to come. Okay, so basically just getting comfortable in that therapeutic situation. Also, the client gains some amount of relief by talking about very superficial things. In the initial stages, the client will not straight away talk about all those traumatic events and all those emotional trauma that he has been going through. Initially, they'll just talk normal things, and even that is going to give them some sort of relief. That is the initial phase. The middle phase is the most important part, and it is the lengthiest phase. This is where all the transference, resistance, interpretation, working through, all of these things will happen during the middle phase. And once the client gains insight, the middle phase ends. So when your client gains insight, you cannot continue to maintain the therapeutic relationship between you and the client. You have to put an end to it. Again, I had mentioned earlier that therapeutic relationship is not a forever kind of a relationship. It is contractual, right? So then you have to formally terminate or put an end to the therapeutic relationship between you and the client. So that's about the psychodynamic therapy.